Good evening. The news gang is here, and it's July, the new August in Kenya. Morning prominent leaders and the chorus of calls to combat cancer. Again, what happened to earlier promises? Also on the show tonight, a bloodless coup in Kiambu County and the new craft of fighting graft. Is Nurdin Haji now Kenya's most powerful man? We'll also have the kicker, the punchline, the take, and the angle. And yes, Jamila is back, so we shall have the memo as well. Welcome to the show. Let's first of all hear what the president has been saying the last couple of hours during a cabinet meeting.
These two deaths have highlighted the very real threat and danger that many Kenyans are exposed to through cancer. And what all of us need to do, and especially us as government, to really come up with a very clear policy to help our fellow Kenyans in this particular fight, because it is definitely a crisis. These two deaths just highlight something that has probably hit every single family in this republic.
So the president speaking about what is clearly a crisis going on, and some people say this is a big crisis in the country, but we tend to talk about it in stops and starts, especially when there are high-profile deaths like this. Very unfortunate, and obviously families dealing with difficult things. But that conversation is beginning to happen in the country. Linus?
I think, as the president says, the death of the two leaders has shocked, perhaps especially government, has shocked it into the realization that this is a big crisis.
And literally within 2 days of each other. I mean, Friday and Monday.
That's right. Yet, for a fact, a lot of poor families have been battling this problem for a long while. It wasn't long ago, I think it was in 2015, when sections of the media reported with very, very good detail about the worrying situation of the equipment, the facilities that are required to combat cancer. And the report at the time by the Daily Nation did indicate that the Kenyatta National Hospital is the country's only facility, and the radiotherapy machines and radiotherapy saves lives were broken down. Now, the story has not changed much at KNH. The facilities of doing the radiotherapy machines is still a worrying situation, not just at KNH, but other referral hospitals that are supposed to have these machines. Then the second worrying issue is a report by the National Cancer Institute, which told Parliament yesterday that 65% of cancer cases are diagnosed in the later stages. That is very, very late. 65%, a lot of people. Some estimates actually put it at a number that is a lot higher than that. Yes, and it means basically you cannot save a lot of lives. So right therein is the problem. We are diagnosing the problem very, very late in the day. Yvonne, this is obviously a very technical subject, and it will take doctors and people in the field to really get to some of the details, but we speak to many experts and they have different views on how we go about this. Where are we missing the ball?
Well, what the medical experts tell me is, for example, the calls for its declaration as a national disaster is a rather simplistic approach to it. So it doesn't quite work the way HIV and AIDS did. And first of all, for HIV and AIDS, for it to be declared a national disaster, among a number of things, is it has to be a disease that is highly transmissible and therefore has the potential to wipe out huge part of the population within a short span of time. But then they say the idea of putting in money isn't necessarily, you know, like a cash thing. And yes, it is expensive. But then the one thing they all tell me is fix the healthcare system in its totality. because cancer is a complex system and is involved at literally every point of the healthcare system, from the primary healthcare all the way up until surgery, palliative care, and there's also a lot of non-medical interventions that are required. I mean, patients need food, for example, and a proper diet, especially when they're on treatment, and that to just come up and say, let's declare it a national disaster, is really not looking at the issues. I mean, there have been a number of missed steps that we have, but that's the one thing they say.
And yet, when we say cancer, it almost gives the impression that this is one thing, yet it's a number of things.
There are over 100 cancers that can ravage the body. Each and every organ of our body can get a cancer, can get some cells that behave abnormally, grow abnormally, and start to. And the challenges and the approach to treatment is very different. Even things like screening. I mean, the approach to screening is very different from cervical cancer, esophageal cancer, colorectal, breast cancer, prostate, you name it. And so it's just, it is such a technical subject and it is so complex that it's not just as simple as let's declare it a national disaster, let's throw money at the problem. There's a lot more that needs to happen just in the entire healthcare system to enable patients.
Joseph, something Lena's mentioned, also Yvonne alluded to it, brings to mind the early diagnosis. The fact that we should be able to diagnose cancer at a very early stages, right at any medical center that you go to. For instance, when someone comes to a hospital with the same symptoms again and again and again, that should be a red flag. I've come to you, I have an infection, you give me antibiotics, and I come back again after I finish that dose and I still have the same infection. That should be a red flag. There should be that screening at an early stage because, as you said, over 60% of cases are actually diagnosed when they're at stage 3 or 4. And you spoke about the healthcare system, the whole healthcare system in the country. Recently, I was in India and I looked at how the healthcare system works there, Joe, and it's amazing how all this equipment, all the screening, the diagnosis, the chemo, the radiotherapy machines, they're all there at an affordable rate for all those who require it. And for me, that was a bit of an eye-opener. I was amazed at how that screening is basic. You go there and it's one of the tests that are conducted. Ni kama unaona vile ukienda hospitali unapimwa pressure, unapimwa temperature. So it's actually discovered at a very early stage.
So it is not a system specifically designed for cancer, but it's an overall, so almost an overhaul of the health system,
exactly,
and helps to catch that at an early stage.
Exactly.
And Francis, interesting that these two members of the public, we could call them, well, the governor used to be a member of parliament, but now a governor, but we could say these leaders came out and said publicly that they had cancer. That doesn't happen with a lot of people. I was reading somewhere someone saying, well, there are quite a number of people even in parliament right now who are dealing with this. A very sensitive thing to just go out and say, but that public appearance of someone saying, I have this, that has its place, isn't it, in this whole conversation about making sure we take the right steps of dealing with cancer, isn't it?
It's unfortunate because look around and almost every family has had or has a cancer situation. If you're not directly affected, you're nursing a relative, you're contributing in a fundraiser to assist a neighbor or member of the family to seek medical attention insofar as cancer is concerned. And what I find disastrous in all this situation is that the amount of money that Kenyans are spending treating cancer is huge, and very many families have been left desperate and destitute because of the amount of money that is spent on cancer. And unfortunately, this discussion comes up very vibrantly in the country whenever our top leaders, our notable persons are affected or have lost their lives. Yet there are thousands of people in villages every day who are passing on as a result of cancer. So I think this is an opportunity now for the government to put its money where its mouth is, because very lofty pronouncements have been made today, have previously been made, and will be made in the course of this weekend, as Ken Okoth, the Honorable Member of Kibra, the late, and the late Governor of Bomet, Dr. Joyce Laboso, are interred. But this discussion should be a day-to-day activity. I mean, when we talk about colossal amounts of money invested in dams and a lot of money has been lost, it leaves many Kenyans thinking, what if this amount of money, or maybe just a slice of it, was invested in proper medical care, such that at Karori Health Center in my village, my village mates there can go to that hospital and be diagnosed properly. Somebody in Karachonyo, somebody in Turkana, somebody in Garissa can walk to the nearest health facility and get this medical attention. If we were to look at that discussion that way, probably it would help. And finally, maybe let's have a candid discussion about President Uhuru Kenyatta's Big Four agenda, and maybe rethink it and convert it to one big agenda, healthcare. Probably once we do that, he may leave probably what would be the most brilliant legacy, in my opinion.
Yvonne, yes.
I want to talk about the cost, because I mean the cost of it is usually quite staggering. Even when we declared HIV/AIDS a national disaster in 1999, a lot of the funds that were used there came from donor funding. Remember, that's how the PEPFAR fund came in, Elizabeth Glaser Foundation, and a number of others. And so even as we're doing that, remember, this is a country that signed up to the Abuja Declaration, requiring that 15% of our budget is actually channeled into health. Even that has not been met. So let's just not underestimate how expensive the investment would be, and how we would then have to have a very sober conversation, which is, if we say we're going to declare it a national disaster, we have to remove money from one area and say that cancer is such a big scourge in the country right now that we put X function or X project on hold and divert some of those funds to fighting cancer. But there's also some things that are frustrating with this government. So the National Cancer Institute was set up 3 years ago. They had one employee for 3 years, one, and it was an acting CEO in an acting capacity. They had a request for 100, they only got 8. The funding they have is 14 million shillings. That funding, by the way, is not even under their direct control. It is in a department in the Ministry of Health. So essentially, a lot of the things, they have about 10 departments that they have set up, which to date remain non-functional. There is that, the cancer center that was supposed to be set up. And even as we say all of this and we paint this grim picture, and the fact that, by the way, and let's be reminded of the prominent people who've died, had the best healthcare in the best parts of the world, but still, many outcomes are not always as successful. That being said, there's a whole number of people that actually live and survive, although it is a big thing. The one last thing I'd like to add to this is, you were talking about how people carry this privately. Well, take a look at what happened when Grace Kipchoim died, the former MP of Baringo South. What were some of the sentiments that people made on Twitter? That if these people know they're sick, they should step aside. So essentially, is that if you have cancer, it should be a death sentence. So go, curl up in your little corner and wait to die. That's exactly what we say. And so it is, for me, the courage of these leaders, and indeed, not just them, but everybody else, all of those 32,000 people who died, to just come up and say, this is what I have, and this is where we're going. We still have stigma, surprisingly, associated.
But amazing that Governor Laboso,
since 1991.
Since 1992.
Yeah,
and that shows you it is such a life.
She was my lecturer in 1992.
You told us,
I mean,
right?
who would have thought?
Who would have thought, and who knew? So it really is, and that shows you the economic burden it is on a family. I mean, resources are wiped out because, and that's the thing with it, it's very complex. So you think you've beaten it, you have a lull, and you go back, then it comes back. It's really
But that bit of people
deal
coming out and then being stigmatized, and isn't that a function of like public awareness, people just knowing what the right thing is to do? Because that is horrible, isn't it?
Yes, because when you talk about stigma, I remember the stigma associated with HIV/AIDS. Remember how people would even move away, not want to be associated with anyone who had HIV positive. You don't even want to declare your status in public for people to know that you're suffering. But for me, I look at it in terms of the 32,000 plus people who die every year from cancer-related illnesses. And I think maybe this number could be underreported, because there are a lot of people who are suffering in silence, maybe in the rural areas, people who we would probably die in the homes without getting any proper medical care. And what worries me is how the poor keep suffering in their little corners, in their little spaces, because they are unable to access this, the medicine, the radiotherapy, the chemo. And even if they do, they are unable to afford it. We have, you mentioned that there are these prominent people who actually got all the best medical care that they could, but still sikio ilifika. So I worry about such things. I worry about the likes of Grace Wamboi, who recently on social media, her video went viral, and she was pleading, she was crying because she could not raise, I think, 1,900 shillings so that her sister could be admitted in hospital to get the care she needed. She was suffering from cancer. She eventually passed on, and now the family is grappling with trying to raise money to get the body from the mortuary to be able to bury her. So I worry about how the poor are unable to afford this care. And two, that the numbers that are being reported here could be much higher than we're seeing, that 32,987.
And now that you speak about data, sorry, just a quick one. Data is very important because by the time we decide where the interventions are going to be, KEMRI, for example, is still mapping the country with respect to cancer. They've only mapped 11 counties so far. We have 47. So you can see how much further we have to go. There is no way we are going to start allocating money if we don't fully understand the scope of this disease. And so data is important, and data costs money. So we really just need to decide where we want to put in our money. And the final thing, food standards, is something that needs to be checked. What are we growing our food with? We need to be a lot more stringent with that.
Yeah. What I find sad is that this weekend, once again, very many big things will be said. But next week, we will be restoring back to factory settings. And then another prominent person unfortunately will pass on, and the discussion around cancer will come again. I had the Deputy President talk about 100,000 people now able to access oncological services. And you still wonder, what are the priorities? Because you hear huge allocations to the Ministry of Health, yet in counties, governors are still complaining of the amount of money that is reaching them for health, which is a devolved function, Linus.
Yeah, Joe, I think this conversation is best executed by experts, and I'm sure they'll tell us what needs to be done in as far as the cancer issue is concerned. But from just the face of it, you look at a number of things that have been going on. We have reported about contaminated food. We have reported about chemicals in meat to preserve red meat. We've reported about imported fish that may not pass the test. We've reported about maize being contaminated. There's so much.
Factory effluents.
Factory effluents, yes.
Sugar.
Yeah.
Yes. How about paying attention to the basics before the crisis happens? What exactly is causing some of these things? I think our regulatory environment in as far as food security, and I mean this now literally in terms of what you eat, whether what you're eating is secure for your body. I think there are a lot of gaps going by even the recent reports. You look at the kind of food that is consumed, there are serious questions about its suitability for human consumption.